Good morning. So I'm Josephine Kershaw, and my colleague Mary and I will be presenting on building global educational pathways for enhancing the reach of community paramedicine. I'm the Associate Dean at Christ College of Nursing and Health Sciences in Cincinnati, Ohio. Just to give some background on our presentation, our report came across my desk that was published just this year called Envisioning the Future of Health Professional Education. It was put on by the National Academies Press and from a workshop from the Global Forum on Innovation in Health Professional Education. Just wanted to share some of the parties who were in that forum. So the American Medical Association, the American Academy of Nursing, the American Dental Educational Association, Council of Academic Physical Therapy. We have the Physician Assistant Education Association, Association of Colleges and Schools of Optometry, many educational associations. For the international component, they had Ghent University in Belgium, and another university in South Africa. They had the University in Uganda, the Kingston University and St. George's University of London in England, as well as University in China, and from Canada, it was the University of Toronto that represented Canada and was on the planning committee to organize it. So I mentioned a lot of educational associations. There are actually 55 of them, and they also had sponsors from the foundations, Robert Wood Johnson, as well as the, let's see, some of the other foundations here that were represented that provided funding for health professions education. But what was missing? The paramedic profession, as well as the development of community paramedicine. So part of the presentation here is to talk about how community paramedicine and paramedics can be at this table that discusses the global the global development of health professions education and envisioning the future of health professional education. So from that workshop, a number of recommendations were put forth, and I'm just going to share 3 of them that pertain directly to our presentation. From the Lancet Commission report called Health Professionals for a New Century, the first one that I want to share is the recommendation to promote a new professionalism that uses competencies as the objective criterion for the classification of health professionals. The second one we've heard, to adopt locally but harness resources globally in a way that confers capacity to flexibly address local challenges. And then the last one, to link together through networks, alliances, and consortia between educational institutions worldwide. And this is a great meeting, an international meeting that is working towards that. So the educational aims of this presentation is to talk about enhancing the community paramedic profession through educational pathways. The purpose that the professionalization of community paramedicine would guide the formal education and curriculum requirements for those who aspire to enter the profession. So, profession, what a working definition for that is that it has a body of knowledge, it has ethical guidelines, and a professional organization that sets those standards and best practices. Another definition here is that a profession arises when any trade or occupation transforms itself through the development of formal qualification based in education, apprenticeships, examinations, the emergence of regulatory bodies for disciplining members, and some degree of monopoly rights to regulate who's entering the profession. So in the development of a profession, there were Colonel McGonigal proposed 3 models, the attribute model, para model, and process model. I'll go over those briefly. So the question is, which model should we look at? And there's no need to reinvent the wheel. And it depends on the maturity of the profession regarding which components of the models that would be used. Since these are already out there and other professions that have been recognized as professions globally as well as nationally, it would be good for us to look at the different components of what made them recognized as a profession. So the attribute model, it describes the traits, attributes, or characteristics that define a profession as different from other professions. What distinguishes community paramedicine as a profession, or as an occupation, as different from others? So defining the standards of the profession, yesterday's presentation, some of those mentioned that there needs to be more definitions, and also to clearly demonstrate how the profession provides a service that's recognized as a social good. And particularly with our complex healthcare systems, what's that niche that community paramedicine would take? In the power model, this looks at different groups and organizations restricting the supply of services within one group that's less qualified and transfers the service to another group with appropriate skills and training. So again, the emphasis there on skills and training. And the last one is more detailed. It's a process model. In the first stage in the process model, it's that the occupation is identified. So the community of those who work within the profession, there's a critical mass that determines that this is now a profession we need to become more organized. The second stage is the educational programs and training that are provided. And here the key event is that there's standardization so that people know that if you have these skills and qualifications, you are a community paramedic. The next one, the Professional Standards Association established, and the purpose of this is to develop those licensure and certifications that recognize those skills and qualifications. The fourth one, the Code of Ethics developed, and these are rules of the profession, and basically the teeth for the Code of Ethics is to provide sanctions. So if someone or an individual does not follow them, it provides disciplinary actions to basically kick them out of the profession until they are in compliance. The fifth one, societal support of the profession is recognized, and here we talked about the importance of sustainability, and that if there are policies that promote the profession and reimbursement of services, that the profession will be able to grow and become and prosper. So just briefly here, McConnell's model for the maturity of a profession. So we talked about community paramedicine as being up and rising. Again, education is very important to define those skills and qualifications. Accreditation is something else that needs to be considered. The process in which there's a certification of competency, authority, or credibility is presented as an independent body. Skills development, and here we have the application of the knowledge through clinicals and other experiential learning before the certification exam or licensure is granted. So certification is an exam in this model, like the CPA exam for accountants, that recognizes the accomplishment of that body of knowledge. Licensing, generally done by a governmental authority, to allow practice in that profession. And professional development, because the field is changing so rapidly in healthcare, and it allows for those in the profession to stay up to date. And the last two, professional societies, where there are groups of like-minded individuals, as here, who put professional standards above self-interest, both themselves and their employers. And the last one I mentioned is the Code of Ethics, those behavioral standards with sanctions for violations of the code. So with those models for a profession, I'm going to hand the mic over to Mary, who will talk more about and go into detail about how community paramedicine as a profession and to be recognized through global educational pathways can be done.
So as we embarked on this journey, the first thing we needed to do was come up with that working definition, and we looked at practices around the world to be able to determine key things. One, we needed a licensed professional. We needed an educational program that we needed that individual to demonstrate competence. We still wanted to operate with our autonomy under medical direction, and we needed to define the specific roles and services that we would provide to the community and within the healthcare system. We also needed to take a look at community paramedicine programs. So we wanted to know the most successful, because that was our drive, is to create that gold standard. We wanted to make sure we followed the community health needs assessment, that we're able to fill gaps, that we worked as an extension of that healthcare system, and our goal being improving community health. We wanted to parallel the international levels, starting with that primary care and up to that advanced provider. We wanted to determine key terms and titles that would be recognized both in the field and in healthcare professions. And we needed to recognize that going forward, we needed to continually educate our profession. So we started with the basic and the foundation of community paramedicine at the primary care level, as internationally known. And at this moment in time, we want to take this piece, and you're going to see in our next chart how we will articulate it up the spectrum. But this individual is that either that new paramedic, maybe coming out of an educational institution now, that wants to kind of get their feet wet and learn about the community paramedicine piece, or it may be a 5 to 10 year experienced paramedic that does not want to go into all the invasive procedures, but does want to be in the community and does want to perform certain items and tasks. Moving forward, we have that intermediate level, or that clinician level, that would be more invasive with the skills. And then we advance to that practitioner, their baccalaureate degree, that we're able to actually design and modify those care plans for our patients in the field. And we want to move forward to the master's degree, and ultimately down the road, of course, the doctorate degree. But we want to remain with that autonomy, and we want to establish our position so we're respected in the field. So to do that, we constructed the algorithm that would allow us not only to educate those in the field and the community, but those within the healthcare system, and to see where we could place certain individuals professionally and get the recognition that they deserve. And you can see in this level, I'm seeing if my pointer works here. I don't know if it's working. In the bottom level in the certificate program, we currently have that EMT and that CPT. But you're going to recognize as we move forward with this program that we ultimately are placing them in the associates and the bachelors, that we're building that track, that we've placed the articulation in place. So if you come through the technician program, it will automatically be articulated into the clinician program, which then automatically will be placed within the bachelor's program. So as you come through and you gain credits, 4 credits in the technician, 14 credits in the clinician program, that those have the articulation agreement to be able to go forward in the bachelor's and the master's. Along those lines also, we've also built in that opportunity for certification. So at each level, if a community paramedic decides to maintain at the technician level and that's where they'd like to stay, then we offer that certification at that level. So as we go up in the career ladder, the certifications are in place to complete the programs. We want to make sure we have an understanding within the healthcare system as to where the community paramedic aligns, because that's real important in the education piece. So we used a real example to be able to educate with. We also wanted to give a detailed example as to those areas that could be meaningful for that community paramedic to actually physically work in the healthcare system, preventing those readmissions. To be able to actually work when they have that bachelor's or master's degree in care coordination within the healthcare system, to be able to really see that how from admission into the hospital you start that discharge planning process through that care coordination and that actual finish of the discharge planning process when they're being discharged from the facility. That's a huge piece for a community paramedic. because not only do they have that opportunity to see that patient coming into the facility, but they also have the ability to coordinate with community paramedics in the field as that patient gets discharged. Along with that, they may also be housed in the specialty outreach programs that are by the hospital or the healthcare system, in those LVADs that leave our facilities. The people that have respiratory therapy on long-term ventilators, that go home with infusion requirements. All those pieces would be learned as that community paramedic as part of that, either that specialty outreach program or care coordination. And out in the community, we can have either those master's levels that are at that level, at that NP or that PA, but can remain with the autonomy that you have under medical direction. That's the important piece with each one of these levels. And obviously then plan for continuation and prevention.
To summarize, for the global pathways, we need those standard definitions of the community paramedic profession and coordinated educational curricula. This is my first IRCP, and meeting Mary and being drawn to this profession and her visionary ideas was a great inspiration. For the College of Nursing, we're developing in the educational pathways in partnership with Hennepin Technical College and Mary, that associates going from the certificate to the associate's level, as well as the bachelor's level. So starting to work towards those coordinated educational curricula that provides credit for the training and the experience of community paramedics that will allow them to receive the associate's and the bachelor's degree. And then, as Mary said, hopefully in the future towards higher master's and doctorate degrees. So the professional association also is very important. Again, to have a seat at the table for these conversations towards the advancement of health profession education and the national and the global level. If it's all fragmented, it would be difficult for these policymakers to know who to invite. A quick example. So you have different sports organizations in the U.S. You have the NBA for basketball and the football associations and such. My daughter does baton twirling, and there's like 5 or 6 or 7 different associations for baton twirling, and it's not considered a sport for the Olympics, although it uses, the baton as well as gymnastics and dance and such, which are considered individual sports. They have very strong associations and leadership. When it's fragmented, it's difficult to be recognized and part of the conversation. So it's good to have that coordination here in the meeting that will be occurring tomorrow to try and have those standards and linkages, not just nationally, to have it internationally will be a really powerful voice. And also the licensure requirements that would be very good to be able to have the professionals not have to get recertified or relicensed when they go from one geographic area to another, or from one state to another, and ideally, perhaps globally, to have that recognition of what a community paramedic is and the skills that are and qualifications that are involved. The code of ethics, I know there's many codes of ethics out there for the different professions, but to have that for community paramedicine to really establish what are the expectations would be something that would be important. And accreditation processes, we've started meetings already as well with different parties that might be involved in the accreditation process. So accreditation would look at educational institutions. So we have the Higher Learning Commission for the Christ College of Nursing and Health Sciences. We have an accreditation site visit on our associates and bachelor's programs that I'd mentioned that would have community paramedicine as a specialty track. So education institutions would have accreditation processes. Individual community paramedic programs would have accreditation processes to make sure that the equipment's in place, that there are sufficiently qualified staff in the facility, and providers in that program. And then you would also have accreditation for the providers and the educational program that would be in place. And the third one would be certification, board certification for graduates of these programs. And we're also starting conversations for that. So there's multiple angles to ensure quality and recognition of the skills and qualifications for community paramedicine that are part of the developing conversation to make sure that these are coordinated and allow that more unified voice. So that would contribute to the legal recognition, so that with that, the laws and the policies that are passed to promote reimbursement and sustainability of the profession, so that those who graduate from the educational programs are able to find careers and pathways that will be viable and sustainable. And here the community paramedic curriculum going from the technician with the associate's level, the clinician with the bachelor's level, the practitioner, did I say those right, Mary? And the advanced community paramedic at the master's level. So this providing a career pathway that allows someone who's interested in the field and those who are already in the field a progression that will go forward into the future.
Let me see if
So references there.
We just want to let you know that we didn't do this alone, that we had representation across the country, and it's been a very exciting process. And we look forward to tomorrow and taking this globally and having that opportunity. Any questions? We'll be here.